Hello, I'm Dr. Tracy McClellan with the Medical Institute of South Georgia, and today we're going to talk about Chapter 4 with the Nurse Aide training. Let's get started. Welcome to Chapter 4, Body Systems. Needless to say, this is a very important chapter that contains a lot of important information. So this chapter helps you understand how the body works so you can recognize what's normal and what's not. As a nursing assistant, you're not diagnosing illnesses, but you are observing daily changes in your resident, and that awareness can literally save lives. Let's get started. In section 1 of your Nurse Aide training book, we're starting with chapter 4, and section 1 is the body as a whole. The human body is made up of systems that work together to maintain balance. That balance we call homeostasis. When one system is affected, it can impact the other body systems. For example, poor circulation can affect wound healing, respiratory issues can impact oxygen levels and energy. Your job as the nurse assistant is to observe those changes and report them promptly. Section 2, major body systems. As you're going through and reading each chapter, anytime you see any bold words, they should be highlighted, and make sure you read the information around the bold printed words more than once, because they're probably very important. The first system we're going to talk about is integumentary. That's it, integumentary, which is another term for skin, hair, and nails. The integumentary system consists of those 3 areas: skin, hair, and nails. You got it. Okay. The skin protects the body and regulates temperature. You need to know that. As people age, skin becomes thinner and drier, so it tears easily as we age. Always handle gently. Keep skin clean and moisturized, and report any redness or open areas. In your book, you're going to see diagrams to show you the different layers of the skin that talk about the dermis, the epidermis. We don't get that in depth, but we do want you to be aware of how that works. Okay, hold 1 second. Let me get back started where I left off. Okay, so that's the integumentary system. So now let's talk about the musculoskeletal system, which is a really, really important system in our body as well. You'll see that on page 84 in your book. The skin, the musculoskeletal system, this system supports movement and posture. Aging leads to weaker muscles, stiffer joints, and slower movement. You want to encourage gentle activity to prevent contractures and falls. And one of the things sometimes that we see with our elderly patients, they'll have a fall and they'll think they fell and broke their hip, when in reality, because their bones become so fragile as they age, their bone broke and then they fell. So with a patient, how does that affect us as care providers? You're going to have patience. They can't move fast. Okay. So recognize that they will be moving slow, and you've got to help them move their body parts slow and even more gentler. With the nervous system, the brain, spinal cord, and nerves control everything we do. So with aging, reflexes slow, the patient's ability, their reflexes are slower, and memory is going to change. But confusion is not a normal part of aging, and that's something you need to be aware of. Just because a person is elderly does not mean that their memory, that they're going to have dementia, that they're going to have Alzheimer's. Those are things that occur in some elderly people's lives. Usually it's always elderly, but all elderly does not mean they're going to develop dementia or Alzheimer's. Always report sudden confusion or speech changes to the nurse and the physician. Primarily reported to the nurse, and then the nurse will report it to the physician. For the circulatory system, going back to the musculoskeletal system, make sure you know the difference between rheumatoid arthritis and osteoarthritis. So look at those differences. They also give you some guidelines in your book about how you care for patients. Make sure you know about osteoporosis. Reading through that section is a condition in which bones lose its density, which has to do a lot with why patients begin to fall as they get elderly. So you just really have to be very, very careful. All right, the next section we want to look at is the nervous system. The nervous system consists of the brain, the spinal cord, the nerves that control everything we do. With aging, the reflexes are going to automatically slow. That's normal, and memory may change. So, but confusion is not a normal part of the aging. Always report sudden confusion or speech changes. I'm sorry, I already mentioned that. Under the circulatory system, the system moves blood, oxygen, and nutrients through the body. That's what the circulatory system's primary function is. So you want to watch for swelling, shortness of breath, or cold extremities. These may indicate that there is poor circulation or heart problems. So that's what circulation has to do with the blood flow. The other system is the respiratory system. The respiratory system, the lungs supply oxygen and removes carbon dioxide. So make sure you're following along in your book. Encourage deep breathing, keep the head elevated for those with difficulty breathing, and report shortness of breath or bluish lips. We call that circummoral pallor. You don't have to write that term down. With digestive system, I'm trying to follow along in the book as well. With the digestive system, aging slows digestion. Residents may have smaller appetites or constipation. Encourage fluids, fiber, and activity. That's going to help keep their bowels moving so that they don't develop constipation and then impactions. Okay. The next system is the urinary system. The urinary system involves the kidneys and the bladder, and we need those to remove waste from the body. Aging can weaken the bladder muscles, leading to incontinence. You need to know what the word incontinence means. Incontinence refers to inability to control urinary output, whether it's urine output or stool output. Always protect the resident's dignity and report any changes in urine color, odor, or frequency. When we say frequency, we're referring to, does the patient go to the potty chair like every 30 minutes, every 15 minutes, every hour, every 2 hours? Every 2 hours may be normal, but every hour or every 30 minutes or every 15 minutes, something's going wrong there. They may have a urinary tract infection, and so you need to report that to your nurse. The next system is the reproductive system. Aging affects the hormones and the sexual function as well. You want to be sure to respect their privacy, and remember that intimacy is still important for many older adults. So in a long-term care facility, you may have a husband and a wife, and they are both in the same room. And if they want to get busy, it's completely okay and legal. They are still adults. They are just living in that facility, and that's completely okay. Your job is to always knock before you enter and make sure that they invite you in before you just walk in, so you don't get a surprise. Okay? All right, section 3, let's continue. Section 3 covers recognizing normal aging versus warning signs that there is a problem. Okay, so normal aging includes changes like slower movement, decreased skin elasticity, and mild forgetfulness. That's considered normal. But warning signs that something may be wrong would be sudden confusion, pain, loss of mobility, sores, or difficulty breathing. Those are things you want to always watch for. Should always be reported to the nurse. Early reporting helps prevent bigger problems. So you want to keep that in mind. All right, section 4, observation and communication. Chapter 4 is a little bit lengthy. Everything is important. So you're probably thinking, okay, what is this? What part of this is important? All of it. Normally, the nurse aid training book is this thick. The course book that you have is designed for short courses like this, so we can cover the overview and give you just what you need to know to get certified and to start working. Everything in this book is important, okay? So section 4, observation and communication. You will often notice small things before anyone else. Maybe a resident is coughing more, eating less, or acting withdrawn. You're going to be the one to notice that first because you spend more time with the residents. So write it down. Make sure when you report it that you report it clearly. And don't assume someone else has already reported it. It's your job. If you witnessed it, you've seen it, you know it happened, it's your job to report it as well. Use objective language. Describe what you see and hear, not what you assume. Now, I want to give you 2 terms to be sure you're familiar with. The word objective, objective, refers to what you observe. You can observe their vital signs. You can observe the color of their skin. You can observe their hair. You know, you can observe whatever you saw with your eyes. That's objective data. Subjective data, which is subjective, subjective data is what was stated. What did the patient say? Did they say they were in pain? Then you put that in quotations. Did they say they were hurting? Then you put that in quotations. Patient states she is hurting. On a scale of 1 to 10, with 1 being very little pain to 10 being severe, how severe is their pain? She said it was a 3. So you put that kind of stuff in quotations, but that's the difference between objective data, yes, and subjective data, okay? Now, in closing on chapter 4, this was a pretty important and big chapter. They talk about congestive heart failure, coronary artery disease. Yes, you need to know what all of that means. Between your workbook and your reading, make sure you document each of those highlighted bold print words where they talk about an inspiration being an inhalation and an exhalation. And we talk about the respiratory system. So this chapter is pretty in-depth. You want to make sure you spend enough time on the content before you take the actual exam for that chapter. In closing for chapter 4, your understanding of the body systems gives you confidence and credibility as a nurse aide. You need to have at least minimal information about the importance of these different systems. Remember, you are not just providing care. You are protecting life by noticing what others might miss because you spend more time with the residents. So remember, you're not just, in chapter 5, we're going to focus on how diseases like Alzheimer's and dementia affect the mind and how you can provide care with patience and compassion. I'm Dr. Tracy McClellan, and that was chapter 4 from your Nurse Aid training book. Get busy.